Dear listeners, in last couple of videos, I have shared my experience about Nosodes and Sarcodes. Somebody asked me regarding this Nosode and Sarcodes, that where to prescribe in practice these Nosodes and Sarcode. What are the difference between these two? So in today's talk, I will share my experience and my understanding about Nosode and Sarcode, where to prescribe these both very important group of remedies. So before I start, let me remind you that nosodes are the remedies which are made from pathological specimens like pyrogenium. Pyrogenium is made from pus, and tuberculinium is made from the tubercular abscess. And same with the sarcodes. Sarcodes are the remedies which are derived from healthy human or animal tissues or secretions, like or folliculinum from ovaries or thyroidinium from the thyroid of the sheep. Now about the difference between where to prescribe nosodes and sarcodes. Remember, in practice, if a patient speaks mostly of their illness or a specific organ or specific part of the body, the best remedy now may be to choose from between nosodes and sarcodes. Like for example, patient come to practice with the sudden toothache due to a tooth infection without any prior cause or issues. Then the only remedy which I give is the pyrogenium, which is a nosode made from the pus. Of course, there are some exceptions when another remedy is indicated, but most of the time I give pyrogenium with great results. Second point, where I mainly give nosodes in those cases where I see recurrent symptoms, or I can say recurrent infection are the dominating part of the patient's condition, or infection is the only cause of the illness. Like for example, I have shared a case of colibacilinum where UTI are the main issue in the patient condition. Third point where I can use nosodes are where you can see this never well since syndrome. So now, what is this never well since syndrome? Let me explain. It is a condition where patient says that after last infection or the illness, my health is never recovered, or they says that since last lungs infection, they are never fully recovered, or they have developed this other symptoms. Or a patient would say that after this last diarrhea or stomach bug, I have developed this long-term condition. In those cases, we must think of the remedies from the nosodes group. For example, psychotico is the remedy which I often use where after lung infection, patients are never fully recovered. In future, I will share some of its cases. Now, you can also use these remedies where our prescribed remedies are not reacting to the condition. So there is a kind of a lack of reaction of the body. In those cases, nosodes are the best options. Then we can also prescribe nosodes where there is not a clear picture of any remedy, because usually patient comes after having a long antibiotic treatment or long infection episodes where you can see this total mixed up symptoms. In those cases, mostly nosodes clear up the symptoms and help us to prescribe required remedy. Keep in mind, in those situations, and do not give high doses of nosodes remedy. Just prescribe 30 or maximum 200 potency, a single or a few doses, of course, according to the situation. But don't repeat these remedies very often. Now, some homeopaths also use nosode remedies as a prophylactic remedies, like influenzium, tuberculinium, diphtherium. So in this sense, we can use them as a prophylactic remedy. But keep in mind that you must ask a qualified homeopath before taking them as a prophylactic remedies. Now about this Sarcodes group of remedies, where to prescribe those Sarcode remedies. In Sarcodes, you can expect to see symptoms that are centered around specific organ. In case of hormonal remedies, we see all symptoms revolve around hormones or symptom related to hormones. Like I have shared a case of folliculinum in my last video. Keep in mind, hormones are the regulatory substance that control over cells and organs to do their work. So they work as a controller or regulatory substance in our body. That is the reason we can see the issue of balance and control are the central feeling in the hormone remedies. Either the things are going out of control or these people tries to control them, like in the case of folliculinum. That is the reason these hormone remedies sometimes look like cancer miasmatic remedies, because cancer miasm has also the issue of control and balance. Either the situation is going out of control or they try to keep control of their symptoms or situation. So control issue and balance issue you can find in Sarcode remedies. We can also use Sarcodes where we need to stimulate a particular organ or hormone or specific area, like remedies are made from a thyroid or liver or other hormonal remedies. So in this sense, Sarcodes patients come with very physical symptoms. So you can call it that they are very physical or symptom-based cases. Sarcodes and Nosodes both are mostly used as an intercurrent remedy as well. That's what classical teachers advise us. These remedies help us to clear the case from different layers of symptoms or disease, or you can call it helps the constitutional remedy to work on a deeper level. In this sense, we often do not repeat them in those cases. But of course, you can also use these remedies as the main remedies as well, where you can see the prominent symptom of a specific nosode. Like I had shared a few cases with you. In those cases, these patients just need a nosode remedy, nothing else. Like I have shared a case of a morbillinum. In future, I will definitely share some more Nosodes and Sarcode cases. But still, in those conditions, you do not repeat these remedies often. Keep in mind that Nosodes and Sarcodes are the remedies which you should avoid giving on regular basis. Like what I have seen that some practitioners give bacillinum or cephalinum or other Nosodes 3 times a day for a long period of time, or sometimes they combine different Nosodes together. This is wrong. This actually spoils the whole case, especially when you are treating chronic conditions. Dear listeners, I want to emphasize here, please do not self-medicate. Always consult your homeopath, your GP before taking any remedy, especially these Nosodes and Sarcodes, because these are very deep acting remedies, and do not take these remedies without consulting a proper homeopath. Especially in severe conditions, you must consult your GP, your doctor, your homeopath before taking any medication or any homeopathy remedy. Jeet listeners, this was today's talk. If you have any question, let me know. See you next time with another video. Bye.